During an annual physical, doctors examine the heart, lungs, and other vital organs. Now, a panel of health experts is recommending that physicians also check their patients for anxiety. The U.S. Preventative Services Task Force hopes annual screenings will diagnose mental health issues and get patients the help they need. Joining me now is Dr. Lynn Bufka from the American Psychological Association. Good morning, Dr. Bufka. Thanks so much for taking the time to talk to me.
Good morning. Thank you for having me.
And we've all felt anxious about something before, but what does it mean to be diagnosed with an anxiety disorder?
Yeah, that's a great question. Anxiety is a completely normal emotional response. But if somebody's going to be diagnosed with an anxiety disorder, that indicates the amount of anxiety they're experiencing is at a level that's really distressing to the individual, or it's interfering in their ability to do their normal day-to-day things, whether it's work or be a student or be a parent.
Everyone has experienced so much stress, especially over the past few years, but when should anxious feelings be a cause for concern?
Yeah, I mean, when we feel like we can't really get a handle on our anxiety, that it's there all the time, it's really interfering with our ability to think, to do the things that we need to do, and it's causing us a lot of distress, we definitely need to reach out and get some support and help.
What is the benefit of screening at the doctor's office during an exam? I mean, some people get nervous going to the doctor.
Yeah, and so this is not about, are you just nervous? This is a couple of quick screening questions that get us at a sense of your level of anxiety on a day-to-day basis. And if it seems to be elevated, they'll move into a more in-depth assessment around anxiety. So they've been doing this around depression for a couple of decades, or the recommendation has been out there to screen for depression, and now they're adding in anxiety as well, because we know more people wind up in a primary care office, a doctor's office, than they do in a mental health specialist. And if we can get a handle on it and get somebody the resources they need, it will help benefit overall their life, and as well as the lives of the people around them who definitely feel the effects of a person's anxiety.
And how would someone be screened?
So it'll be a couple of questions. It could be even on the intake paperwork that you do when you come in, and might ask you about the level of anxiety you experience on a day-to-day basis.
So tell us, what would a general practitioner do with this information?
Yeah, it depends on the setting the person's in. Sometimes there's a behavioral health specialist right there working in coordination with the primary care provider, so then they can take you right down the hallway or refer you to that person. Or they might have some resources to give you, whether it's some self-help resources, things like that. But the next step is always going to be more of an assessment. So either the primary care person's going to do that, or the specialist they'll suggest that you connect with, so that you can get more of a sense of how pervasive is this, where is it happening, and then depending on the level of severity might determine the kind of intervention.
And as you know, mental health issues still met with resistance in some communities. How can we help overcome that stigma?
By talking about it, by acknowledging that we all have our ups and downs. We all have times when we're going to feel anxious or depressed, and that's okay. It's part of the human existence. But then to celebrate ways that we can also experience our joys together and support one another during tough times helps everyone to realize they're not alone in how they're feeling, and that it really can make a difference to seek support and help.
It's just so important for people to know that there is help out there, and they should ask for it when needed. Dr. Lynn Bufka, thank you so much from the American Psychological Association. We really appreciate you taking some time to talk to us.
Of course, thank you.
The task force's findings are recommendations and would not be compulsory. If you'd like to see their report, you can go to our website, cbsnewyork.com.